Before we dive into Medicare Secondary Payer, it's important to understand that that statute that we'll be discussing today follows the introduction of the Medicare program. Signed into law, introduced summer of 1965, effective January of 1966. Medicare is federally funded health insurance that's available for individuals age 65 or older, or if you're younger than age 65 and been deemed disabled by the Social Security Administration or receiving Social Security disability income or SSDI benefits, or for individuals who are afflicted with end-stage renal disease or Lou Gehrig's disease, ALS. Those are automatic qualifiers for Medicare coverage. So it's important to not make the assumption that Medicare only applies to the elderly, because there are more than 12 million Americans today who are Medicare enrolled and receive Medicare coverage, but are not age 65 or older, okay? When we talk about this in the Medicare Secondary Payer context, there's really 4 parts to Medicare coverage that you want to be concerned with, and that is parts A, B, C, and D. So part A is hospital insurance. Part B is medical insurance, meaning provider coverage, etc. Part C is Medicare Advantage insurance offered by private healthcare plans such as Humana, Kaiser, Aetna, etc. And then Part D is Medicare prescription drug coverage offered by the Aetnas or the Silver Scripts of the world. So 4 parts to Medicare coverage that we need to be concerned about under Medicare Secondary Payer. There is other types of Medicare out there, most notably Medicare Part G, which are Medicare supplemental plans. It's important to understand that those plans do not fall under Medicare Secondary Payer and do not have the same recovery rights as these other plans under the Medicare program for the MSP Act. As far as data goes, I wanted to share this slide with you to demonstrate the growth of the Medicare program. Obviously, we're in the middle of the baby boomer generation becoming Medicare enrolled. So as of today, we have approximately 67 million Americans enrolled in Medicare. Of those 67 million Americans, 23% of those are at least age 80 years old. And then of them,